We're now going to take a few moments to share an exciting update on the development of Inflamed Brain Alliance's Canadian PANS Registry. This work is being done in partnership with Lumiio, a leader in real-world data collecting digital health solutions. They are based right here in Calgary, and we're so pleased to be partnering with them for over a year already. And Marnie meeting on a weekly basis with someone I'm going to introduce here shortly. But first, I'm pleased to introduce to you Blaine Penny. Blaine co-founded Mito Canada 15 years ago after his son was diagnosed with mitochondrial disease at the age of 4. He is also the CEO of Lumiio and brings both professional expertise and personal passion to his work. Following Blaine, we'll hear from his colleague Victoria Hodgkinson, and Lumiio's Chief Scientific Officer, who brings a strong research background and a deep commitment in patient-centered science. I'll go off script here for a very short time. Blaine is a friend, a mentor, and a hero. And you will find out why, and you'll find out why here tonight, but you'll find out more ahead. So I'm really, really pleased to introduce Blaine and Victoria, beginning with Blaine. Thank you.
Well, thank you, Richard, for those kind, warm words, and it's an honor to be here to speak to you this evening. Welcome, everyone. It's incredible to see so many people here. I met Marnie and Richard about 7 or 8 years ago, and it was through a mutual friend. And very quickly, we found ourselves sharing our personal stories, and each of us with parents who were affected by conditions that were poorly understood and for which there were few answers. My own journey began 17 years ago when my son Evan suffered an unexpected brain injury. And after a year of uncertainty, Evan was eventually diagnosed with a mitochondrial disease, a condition that few people, including many clinicians, knew much about. Like so many families, we felt lost. But in that uncertainty, we found connection with others on a similar journey. Together, we founded Mito Canada, much like Richard and Marnie have founded this organization. It's incredible. And at Mito Canada, we had a mission to support families, to raise awareness, and to raise funds for that much-needed research. Early in those days, we had conversations about building a patient registry. We saw how essential it was to understanding the disease and driving progress. But at the time, we felt like it was a black box. Who builds it? Who owns it? Who owns the data? What's the role of patients, clinicians, researchers, and how do we make it sustainable? And it wasn't until I met Dr. Lawrence Korngut and Dr. Victoria Hodgkinson, who you will get to see and hear speak in a few moments, that those questions began to take shape. They had spent over 15 years building the Canadian Neuromuscular Disease Registry, which is now considered the gold standard for registries in Canada and in neuromuscular disease worldwide. That's pretty impressive. And it was through that experience and that success that they decided to create Lumiio to take that further and expand that model across more diseases and around the world. And for me, my tie into this was I had a background in engineering and technology, and I joined the Lumiio team just over 4 years ago after hearing about the great work that they're doing, and I wanted to be part of that, to help build that infrastructure and digital tools that I knew were going to be so essential to empowering patient communities to collect that high-quality, meaningful data that can fuel research, inform care, and ultimately improve lives. Today, Lumiio supports programs in 18 countries across 14 diseases, and that impact has been both humbling and inspiring. But I also want to acknowledge something that many of you here know intimately, that starting a patient organization is no small task. You need a board, you need a strategy, you need to raise funds, You have to host events, organize conferences, like it's full on. And this is all done and started by volunteers, all while working full-time, caring for their families and their children, and trying to live their own lives. It's truly inspiring and deeply moving to witness the progress that's been made through the dedication by Marnie and Richard and so many others here today. To stand in this room surrounded by patients, clinicians, and researchers united for the very first IBA conference is a powerful testament to what's possible when a community comes together with purpose and hope. And with that, I want to introduce someone else who's been instrumental in the work that is going to help make that progress happen here at the Inflamed Brain Alliance. So Dr. Victoria Hodgkinson is our Chief Scientific Officer, who is an incredible human. She's brilliant. She's a global leader in designing registries that are rigorous and scalable and impactful. She brings a deep understanding of how to align a registries and design with scientific and clinical and community needs. Please join me in welcoming Victoria.
Excellent. I'm not sure how to follow that. Everyone's too kind. I couldn't do what I do without the support of our fantastic team and leadership. So thank you all for welcoming me here today, and I'm really here today to share to you, as Richard and Marnie mentioned, over the past year we've been working together really towards this goal of launching a national registry in Canada for individuals affected by PANS and PANDAS. So just really briefly, I think Blaine did touch on this, but really Lumiio, we are a data company, but we come from the perspective of building health communities. So our goal and our mission is really to establish and build and empower 1,000 health communities through data. So leveraging data to build the community, and we're on our way, but some way to go. We come at this really from, we don't own the data of the programs we do, that belongs to the community, and really helping drive forward the message for each of these individuals affected by these diseases. So on to the more important stuff of today. We're here to announce the to-be-soon launch of the Canadian PANS Registry. Yeah. And I really want to thank the Inflamed Brain Alliance for all of their work over the past year. Numerous meetings talking about how do we set this up, how is it going to operate, what information do we need to collect, what is important to families affected by this disease, and then how do we start working in future steps with the clinical community and engage them in this process. And so I'm excited to say the registry will be live tomorrow morning. We're just, yeah, it's a big day. I got my developers on the phone. I'm like, is it ready? Is it ready? We need to launch. We need to go. So tomorrow morning is the D-Day. So we'll see it then. Yeah, it's a good day. We're feeling great. So Marty asked me to come and speak a little bit, just really to help understand, why does this matter? Why is this important? Why do we need a registry in Canada? And really, as you all may well know, there are plenty of challenges faced by this community and other communities, rare disease, common diseases, trying to understand, who is affected across the country, who is experiencing this disease. We know that the care is fragmented, especially in Canada. I mean, this is common in many disorders and diseases, provincial care. So people are getting different quality, different consistency of care across the country. We know there's a very long pathway to diagnosis. It takes many years for individuals to get to that diagnostic stage. And we don't have a lot of data on the quality of life. How does this impact the lives of individuals affected, the caregivers, the families, as we heard from Blaine? And really looking at access to treatment options as well. So when you do get that diagnosis, how are patients being treated? What is going on there? And how do we help support Canadians getting access to appropriate treatment? So what do we do? I always like to start with the slide of just saying, what is a registry? For those of you who don't know, it really is a database that is collecting information from many individuals and usually categorized as individuals with a disease, like PANDAS. And really the goal of the PANS and PANDAS registry is to facilitate data-driven advocacy and research that will benefit patients, families, and caregivers. So that's the overarching goal. That's what we're moving towards as a community. And how does it work? It's a good question. Really, hopefully fairly straightforward. So there is a web-based portal. You can all find it tomorrow morning at pansregistry.ca. We'll share that again tomorrow. We'll have the QR code up to access the website. But really, adults affected by PANS PANDAS or guardians of kiddos with PANS PANDAS can come into the portal. It is under an ethics approval, meaning that you need to provide informed consent to participate in the study, to understand what happens to the data, how it's used, how it's managed, and make sure you agree to that. Then you would enter your data into the platform, and I'll share a little bit about what that looks like. And then data can be requested by researchers, by advocacy organizations around the world who would like to understand more about PANS PANDAS in Canada. There is a governance steering committee that will control the use of that data to make sure that patient privacy is protected. It's very important. We as an organization do not use the data except at the request of the IBA, the owners and the governors of the data, and the steering committee that is in place. And you can also consent to be contacted for other research opportunities. So once individuals are registered, there could be a study, a survey, something else that's going on in the academic community, and they can use this tool to recruit patients to contact you and say, hey, there's this opportunity. If you're interested in participating in research, please reach out. So I touched on this briefly, what information is collected. When you log in tomorrow, you will be able to see this is what the platform will look like. We're collecting information on who you are, your family health profile, so affected siblings, relationships, that diagnostic pathway, understanding where did you get the diagnosis, who gave it to you, what was that timeline from symptoms to diagnosis, looking at, obviously, the symptoms for PANS PANDAS, treatments that are being had, any school sort of educational support that's being used, as well as healthcare access and financial impacts of living with PANS and PANDAS. So lots of little questions. It's a one-time form. For right now, we may move into longitudinal, collecting data over time if we're looking at progression of symptoms, but for right now, it's really trying to build this picture of who is in Canada and what have your experiences been to date. And so how are we going to use this data? Well, the hope is that it'll be used by lots of individuals from around the world over time, comparing against different countries who may be collecting similar data. But in the short term, really, it is focused on understanding the number of Canadians living with PANS PANDAS and where they are across the country, looking at differences in diagnosis, care, and access for Canadians living in different provinces, living in different regions of the country, as well as understanding the symptoms that individuals are having and if they're responding to certain treatments or not. Almost done. So our last slide, data security, very important as you are giving your private information. You're identifying who you are, giving health information about your family members. Just to add that we do have this institutional ethics review to make sure that what is being done is very ethically sound. The processes are in place to protect privacy of individuals. We as a company have very secure third-party assessments to make sure that our platform and our technology is built, robustly enough, comparable to online banking and our procedures and how we manage that data, and conforming, of course, to regional and national regulations that we're required to. Importantly, we talked about with a few people today, the data is stored in Canada. It does not touch the US soil, very important to say, especially in today's day and age. We heard from Dr. Sweeto this morning, data in Canada. And importantly, when we share data, when researchers request access to data, individual level data may go to academic researchers without information about who you are. So very de-identified, we'd say. We remove the information about who you are, but the clinical information. And importantly, if it goes out to industry partners, no individual level data would ever go out to a non-sort of research community. So protecting and privacy policy in that sense. Getting to the end, so really just to say, again, reiterate how important this is to get involved, to share your voice. Every voice matters as we try to build this picture of PANS and PANDAS in Canada. And so a call to action is to register tomorrow morning, share it with individuals in the community. And what do? You know, I made this slide when we weren't quite sure if we were going to make this timeline. We were collecting an information sheet of individuals who wanted to be notified when we went live. We will still send out notifications to that list. You can visit us in the little box room with all the swag over there. Or you can contact the registry at this email address, pansregistry@inflamedbrain.org, and really, hopefully straightforward. Come into the portal, sign up, read the informed consent. If you have questions, you know, don't hesitate to reach out to the registry email to me directly. That's part of the consent process, that you understand what you're reading, what you're signing up for, so you can connect with us and ask any questions, and sign up and share your information. Yay! So I'm done. Thank you. Could ask Marnie if there's anything else I missed. We're good? Okay. Thanks, Rich.
That's pretty exciting news, isn't it? Yeah. Thank you to Lumiio. And something that I don't think I mentioned earlier, the dinner sponsor tonight is Lumiio. So thank you, Lumiio, for the dinner.